I am assuming you're thinking, wow, that is a funny hat you're wearing. Or are you a nurse? I get at least one comment a day about my fancy hat, or if I really am a nurse. My response to my patients is usually no, I am a surgical technologist. I currently am a surgical technologist, and I have an important role during surgery. Most people go through surgery at some point during their lifetime, and I totally understand how scary it may feel to be the one lying on the operating bed, or how it may feel trusting all the people in that room with your life. For a surgical technologist to accomplish a successful surgery from beginning to end, the three most important steps follow: picking the specific supplies and equipment, setting up surgery, and during the surgery. The first step to a successful surgery is using a preference card and making a case card with all the specific supplies and equipment needed for that case. Stated by Dr. R. Nigo, surgical preference cards are the keystone to a safe and efficient perioperative suite. The definition of a surgeon's preference card, according to Dr. Preference Cards About Us, is that a preference cards list all the necessary equipment, instruments, and supplies needed for that specific case and that specific doctor. Surgeon preference cards can also hold side notes that the doctor may specifically like during that case. Examples could include light handles, packs, skin markers, bed straps, gloves, gowns, drapes, towels, and skin closure. Instruments and medications can also be found on the preference card. This list can go on forever and is very different per surgeon and per site. The definition of a case card by Crystal, by taking the preference card specifics and putting all the necessary supplies, instruments, medications, positioning aids, and anything else that is specific for the case and putting them on a cart. That way, the day of surgery, it is wheeled into the operating room and everything, all the sterile supplies are right there. The equipment isn't picked until the day of surgery. The correct operating bed, instruments, and equipment is brought into the operating room along with the case card. Examples of equipment can include microscopes, headlights, bovie, suction, and many others. Examples of instruments could include a general pan, plastics pan, eye pan, laparoscopic pan, and many others. Every instrument that is needed for that specific case comes in a sterile instrument pan. Surgeon's preference cards include important information specifically that doctors want for surgery and is put together on a case card. Now that the surgical technologist has all the necessary supplies and equipment for surgery, they are ready for the case. The second step to a successful surgery is always maintaining a sterile field, properly setting up and organizing the operating room, having a clean and organized setup, and always starting with a perfect initial count. A sterile field is important to maintain throughout surgery to prevent the patient from developing an infection. If a break in sterility occurs, it needs to be fixed immediately. Stated by the Principles in Practice textbook, maintaining a sterile field and setting up an organized case is one of the most important jobs of a surgical technologist. It is important to always make sure when you're opening sterile supplies to have enough space in between our bodies and the sterile field to make sure there is no contamination. When setting up the sterile field, the surgical technologist puts the most important instruments on the Mayo stand while leaving all the other instruments and supplies on the back table. It is important for the surgical technologist to be organized from beginning of surgery till end of surgery because of counts, always knowing where the instruments are in case the doctor asks for one, and it is mostly because of providing a safe environment. You don't want sharps lying everywhere, as this can be hazardous to the patient and the staff. Also stated by the Principles in Practice textbook, by organizing the operating room, it is essential to have all non-sterile equipment in the room plugged in and in working condition. Crystal had stated that having a perfect initial and supply count is important during surgery so that you have a baseline to go off of. That way, when you do your closing count, if you are missing anything, you will know. If you don't have a starting point, you have no way of knowing what is actually there and if something gets lost in the patient. When we count supplies, it needs to be done between two people, which is usually a surgical technologist and a registered nurse. All instruments are counted off a count sheet. Maintaining a sterile field, setting up and organizing the operating room, creating a clean and organized setup, and having an initial count are all important roles for the surgical technologist to fulfill a successful surgery from beginning to end. Now that we have created an organized and clean sterile field, set up the room, and have an initial count, we are ready for surgery. The third step to a successful surgery is staying organized, anticipating each step, listening and watching the surgeon's hands to assist with retractors, bovies, and suction, and to have a perfect final count. Staying organized is important because when a surgeon asks for something, you know exactly where it is. This allows the surgery to run more smoothly. On the Mayo stand, which is the table that goes across the patient legs, which is where the surgical team works off of, are basic instruments: local anesthetics, knives, scissors, pickups, and clamps and retractors. Anticipating is important in surgery because the surgeon doesn't always have to ask for everything, and the surgeon doesn't have to wait for you to be ready. For example, if you give a surgeon a knife, the next thing they are going to need is bovie to cauterize the bleeding. If you give a surgeon a stitch, they are going to need a pickups to hold the tissue, along with a suture scissors to cut the stitch. Anticipating during surgery will come with practice. Anticipating helps with the surgery to go more smoothly. A good surgical technologist is always one step ahead of the surgeon. Stated by the Principles in Practice textbook, handling and passing instruments are important tasks of the scrub technologist. When passing the surgical instruments, it is important to remember what the dominant hand of the surgeon is. Heavy instruments are passed firmly, and delicate instruments are passed lightly. When passing sharps, we always need to make sure that the sharp portion of the instrument is in view and to be safe when handling. There are also hand singles that the doctor may use. For example, this is scissors, this is pickups, and this is a stitch. This is usually done when the surgeon does not want to speak too loudly, when the patient is only under a local anesthetic. Stated by the Principles in Practice textbook, a retractor is placed at the wound edges to pull back the more superficial tissues and expose underlying anatomy. Suction is also used to maintain a clean visual field, and bovie is to prevent bleeding. It is a cautery machine that basically burns a blood vessel that is bleeding. Crystal had stated that having a final perfect count is important because you don't want to have any instruments or small countable supplies left in the patient. You always want to make sure you are leaving that surgery with exactly what you started with. If you do a final count and something is missing, the first thing to do is count again. And if you are truly missing something, then you need to announce it to the entire OR, and in some cases you need to bring an x-ray to see if they can find the missing equipment in the patient. Otherwise, nobody leaves that operating room until the missing item is found. A patient can never leave the operating room with a non-perfect count. Staying organized, anticipating, listening, and watching the surgeon's hands, assisting with surgeon needs, and ending with a perfect final instrument and supply count are all important duties for the surgical technologist to have a successful surgery from beginning to end. A surgery case card is picked, a perfect setup, and a successful surgery itself is accomplished are ways that a surgical technologist can ensure a successful surgery. No surgeon has four or more hands. No surgeon can work alone, and surgery is a team effort. A surgical technologist is an important role to have a successful surgery. A surgical technologist helps a surgery be successful from beginning to end by going through three important steps: picking specific supplies and equipment, setting up for surgery, and during the surgery. Surgery is a scary experience to go through, and yes, it is normal for your heart rate and blood pressure to be out of normal limits. But the next time you are having surgery, don't think of everyone in the operating room as a nurse, but instead take a look at the back table with a person wearing a mask, gown, and gloves. That person right there is the surgical technologist, the best right-hand man every surgeon needs to complete a surgery successfully.